The human hand achieves massive grip strength and delicate fine motor skills for one specific reason. The heavy lifting isn't done in the hand itself. The driving muscles are remotely located up in the forearm. Looking at this illustration, you see how remote forearm muscles connect to distant finger bones using long biological cables called flexor tendons. If these cables floated loose, bending your finger would cause them to rip away, a severe mechanical failure known as bowstringing. To prevent this disaster, the hand relies on highly engineered structural anchors called pulleys. The most crucial is the A1 pulley, located right at the base of the finger, which acts like a rigid O-ring that a taut cable must glide through. The hand's functional brilliance relies entirely on a frictionless spatial clearance between this moving cable and its rigid housing. When that essential spatial clearance suddenly vanishes, the entire mechanism breaks down into a condition formally termed stenosing tenosynovitis, commonly known as trigger finger. The patient experiences a bizarre mechanical glitch. They easily close their hand into a tight fist, but they are completely unable to open it back up. The digit gets trapped in a sharply bent position. Tension builds until, without warning, the finger violently snaps perfectly straight. To understand why this happens, we have to uncover the exact microscopic variable that causes this robust biological pulley system to fail. This anatomical diagram isolates the exact site of the failure at the A1 pulley. Notice its highly vulnerable position at the transition zone where the palm meets the finger. Because of this location, this specific O-ring absorbs the highest amount of shear force and internal friction during repetitive gripping motions. Over years of repetitive stress, that chronic friction slowly degrades and frays the tendon's microscopic gliding layer. The body's cellular repair mechanism attempts to fix this fraying, but it is deeply flawed. Instead of replacing the organized structural fibers, it lays down a dense, chaotic web of thick type 3 collagen. This cellular chaos hardens into a distinct swollen nodule on the flexor tendon. At the exact same time, the surrounding A1 tunnel thickens and shrinks inward, creating a severe physical bottleneck. Repetitive mechanical stress biologically tricks the hand into building an impassable roadblock inside its own finely tuned pulley system. That roadblock creates an extreme force imbalance during the exact split second of the triggering action. The closing motion is easy. The flexor muscles are massively powerful, easily generating enough force to drag the newly swollen nodule backward through the narrowed A1 tunnel. But the opening motion relies on the opposing extensor muscles. Tasked with pulling the finger straight, they are vastly weaker, and they completely lack the force to pull that nodule back out. The entire system is paralyzed by physical resistance. It reacts exactly like a thick wooden wedge jammed tightly under a door. Tension builds within those weaker extensor muscles until it finally overcomes the friction, causing the nodule to violently pop through the tunnel. The painful snap patients feel is simply the violent release of stored kinetic energy when a biological wedge is finally forced through a rigid bottleneck. Medical interventions approach this problem by treating the hand as a machine, utilizing precise engineering solutions to resolve this severe volume mismatch. The first logical fix is to stop the friction by immobilizing the finger with a splint, giving the cable a chance to shrink back down so it can once again fit cleanly inside the tunnel. As we see in this historical photograph, doctors also use localized corticosteroid injections. These chemically shut down the inflammation to rapidly dissolve the swollen nodule. This chemical shrinkage allows the cable to successfully clear the tunnel in up to 90%. The tendon is completely freed, the trapped tension vanishes, and the finger can once again glide without friction. Trigger finger proves how a microscopic spatial error can paralyze an entire machine, and how understanding physical architecture allows medicine to restore motion.
If you like this video, give us a thumbs up